We're still waiting on a comprehensive COVID-19 vaccination distribution plan. NBC 26 Today anchor Brooke Hafes joins us with what we know about those plans so far.
Johns Hopkins Center for Health Security released an ethics framework for who it says should get priority. There are 2 tiers of groups it says should go before the general public. No surprise, frontline healthcare workers taking care of COVID patients, people over 65, and those with underlying health conditions and their caregivers. Also noted are people who work in the vaccine industry and will be administering them. School, food supply, and public transportation workers were also on the list. One issue with that first tier is that's a lot of people, more than 90 million by some estimates.
So it's quite possible that when vaccine is first available, there won't be enough for everybody in this top tier. And so there may need to be prioritization within this top tier.
The Tier 2 group includes other healthcare workers, people living in remote locations without access to quality care, and other essential workers like delivery, military, and first responders. It also includes people who live in places where they can't socially distance, so inmates and people in shelters. The framework also mentions this is a decision that shouldn't only be made by experts and officials.
The public needs to be engaged. They need to have an opportunity to weigh in this because, after all, they're the ones who are the recipients of the vaccines, and whether they get it or not.
The good news is the scholars don't see cost as a barrier to the vaccine, and while a vaccine is the best hope for controlling the pandemic, it will not be a magic bullet right away. Some decisions about who gets the vaccine first can't be made until one is ready. That's because researchers need to know how it may impact groups like the elderly or pregnant women. Brooke Hafes, NBC 26.